Referral forms. A referral form is to be filled out by the staff taking the referral at the time of the referral or shortly thereafter. A referral form must be completed and filled out and given to the QA department within 24 hours. The date and the time of the assessment will be filled out on the referral form and emailed to the clinician who is doing the assessment. If a staff member is given related information for referral services, a referral form is completely filled out. A completed form will be given to the QA department, and at this time, the assessment is scheduled. The referral form is sent to the assessing clinician prior to the assessment, and all services are appropriate for the family should be determined at each stage of planning for the family, including but not limited to the family team meetings, therapy, referral to CMH waiver, psychiatrist, and other appropriate services. You can go ahead and look at Appendix A in the Policy and Procedures Manuals to get a copy of the intake packet. Also, you can see Appendix B and C for a copy of the referral form and the reassessment form. For outgoing referrals, it is the policy of TSI to refer to outside resources, including treatment facilities, DHS, JCS, community resources, schools, therapy, and other community entities that we feel would be appropriate for our families. When a client is referred to another resource, it will be documented in the treatment file. Okay. Some general policies and procedures for our clinical operations is that we have policy on private pay standards. The private pay clients and cases will be held at the same standards and the case managed as the same by any other insurance company. The case will be staffed in clinical supervision and will have the same required documentation, including an assessment, a treatment plan, case notes, and a discharge. The procedure would be the same as to refer to the procedure in all new cases that we get. Now, we do have what we call a 50 units. So after an approval for the initial 50 units through Magellan, it is assigned, and behavioral interventionist will be responsible to ensure that the appointment is made and ensure that the patient has a continuum of services. The procedure is the therapist will assess the current mental health state of the client and determine if the initial 50 units would be in the best interest of the client based on the current GAF score, CHI score, and the totality of the circumstances of the referral. The therapist, care coordinator, or designee will enter in the 50 units appropriate on the Magellan's website. The request will be logged, and if the request is denied, the patient will be placed on a phone call list for review. When the request is approved, the behavioral interventionist will make contact within 24 hours with the client or the client's parent or guardian. The units authorized will be utilized within the time frame given by the behavioral interventionist. The BHAS worker will assure that the patient is seen by the therapist completing the initial assessment within the next 30 days. After the consultation with the assessing therapist, it will determine whether or not they should be placed on the review for an additional units. At this time, there must be some type of progress report in the works. The case, this would consider the case to be high needs case, and the patient does not have an ongoing therapist. The patient will be asked to see a therapist on a minimum of a monthly basis. Any reauthorization will require a progress report. The only exception is with the first 50 unit approval. If the BHAS worker attends the appointment with the patient is seen by the therapist without the interventionist, a progress report is needed. Now, our policy on missing appointments. TSI will maintain appointments with clients to the best of our ability. The procedure is, if a client misses an appointment, the staff assigned will contact the client within 24 hours and reschedule the appointment. If a client misses the appointment for a second time, the staff will contact the client prior to the appointment to remind them of the next scheduled appointment. If a client misses a third appointment, the client will be asked to sign a contract regarding missing appointments, and the staff will uphold the contract as it is spelled out. If a staff member must miss or reschedule an appointment for any reason, they are able to contact the supervisor immediately and reschedule the appointment as soon as possible.